Now, it is a condition so rare you might not even have heard of it, despite the fact that George Clooney said it pushed him to consider taking his own life. It's called CSF Leak, and there are around 50 cases per year in Scotland. One of those sufferers is David Baldwin, and he's now set up his own charity to raise awareness. Good morning to you, David.
Morning, Kaye.
Good morning. And we also have your neurosurgeon with us, I think, James Walkden. Good morning, James.
Good morning.
Good morning. James, first, would you explain, and I'm sure, David, you're more than capable of doing this, given that you've set up a charity and you've actually lived the experience, but James, could you just tell us what CSF leak is? Because I had not heard of it.
Yes, unfortunately it's quite a rare condition. CSF is cerebrospinal fluid, so the water that surrounds the brain and entire spinal cord. The leak component, the CSF, is contained in all of us within the meninges. So most people will have heard of meningitis, which is more common. That's infection of that lining. Unfortunately, in CSF leak is when there's a small hole. It could have been following surgery or just occurs on its own, and the CSF leaks out, which then means the brain and spinal cord is no longer buoyant and supported by the water. So patients get a wide range of symptoms and problems, as I'm sure David can tell you about.
And I mean, is this a dangerous condition? I mean, I know David's going to tell us how horrific it is to live with, but I mean, does it carry danger?
You can, in rare circumstances, have life-threatening loss of, depending on how much fluid is lost, the brain can actually sink down completely. I've personally had experience of 3 or 4 patients nearly succumbing to this. Fortunately, it was recognised at near the last minute and intervention was undertaken, but potentially it can be life-threatening.
Well, I mean, I know diagnosis of the condition is, a real factor here. But David, tell us, how did you become aware that you had CSF? I'm sorry, I'm struggling with it. Leak.
That's all right. It can be a bit of a tongue twister.
Yeah.
So for me, it came pretty much out of the blue. I used to do a lot of whitewater kayaking, and I was kayaking one evening, and I just didn't feel well. I had a shortness of breath, and I had heart palpitations, and I felt a little bit dizzy, but I couldn't really put my finger on it. I went home and I went to sleep and didn't really think much about it. But the next morning, when I got out of bed, as soon as I stood up, I had a headache, and it wasn't your normal kind of headache that you could take a paracetamol and forget about it. It was a very prominent headache, but it kept getting worse. So as I was getting ready to go to work, this headache was ramping up, and by the end of the day, I couldn't even stand because of it. I couldn't walk between my bedroom and the bathroom. I had to crawl. It was that extreme. So I knew there was something very wrong. That sort of pain in your head isn't something that most people would experience. So, and then as the days passed, I got a whole load of other symptoms that came along as well. So I had the pain in the head, but my vision started to go blurry. I was getting double vision. My hearing was starting to go. It was dulling. I had tinnitus constantly. My concentration and my memory was affected, so I couldn't even choose a meal off a takeaway menu that my wife had given me because the focus had just gone. One of the really odd symptoms that a lot of people with a CSF leak get is this feeling that your brain is being pulled down your spine. It's a very hard symptom to express to somebody who hasn't felt it, but it's a kind of unrelenting pressure, as if there's maybe bricks on your head pushing your brain down, which is it's a horrible one to live with. So the headline symptom is headache or head pain, but actually some of the really debilitating symptoms are not necessarily the headache or pain. It can be these other ones. But I guess the key component to all of this is that these are symptoms that when you're lying down you don't have, or they're much reduced, but as soon as you sit up or you stand up, they come back with a vengeance. And it's that element which just makes it such a disabling condition that you just can't live your life like that. You have to lie in bed. And now
so when you're horizontal, you're kind of okay?
Yes, Yes, yeah, and I think that's one of the cruel elements about a CSF leak, is that when you're lying in bed, many people can feel fairly normal. Some people will never feel entirely normal. Some people feel completely normal when they're lying down. But you can feel like you can get up, you can go to work, you can live your life, and as soon as you sit up, it's like an egg timer. It's only a matter of time until these horrific symptoms come back and force you back to bed again. So it's a very tough one to live with. It's very disabling for many people, and it's most certainly very life-changing.
Yeah. So that's because, James, then, so when you're lying down, your brain is not... well, gravity, I suppose. Your brain is kind of sitting even. I'm thinking like a plumb line. And then when you stand up, because it's not got the fluid to support it, your brain starts screaming. Is that more or less it? That's
correct. It's basically what Archimedes described. So if you imagine your rubber duck floating in the bathtub, the water reduces the weight of the brain. So if you have a little leak around your plug hole, the duck will sink down. But obviously, if you lie flat, that gravity is no longer effective, and the person normally feels, as David said, if not normal, certainly there's a vast improvement in their symptoms.
So, David, I mean, how can you live a life horizontal?
Perseverance. I think the general human instinct is to live your life, so you try your very best. I mean, I was a very active person, not just kayaking, mountain biking, hill walking, camping. I was always busy doing stuff, and I've had to adjust to take pleasure and comfort out of the smaller things in life, but it isn't easy. And I think the mental health side and the daily struggles and the kind of non-medical impact, if that's the right way to put it, on your life is huge, and it's something that doctors aren't there to help with all the stuff at home. That's not their role, but I think it's often overlooked at the impact that it has. I mean, I have, in the last 2.5 years, I've probably left my house about 10 or 15 times, and most of that has been in a stretcher ambulance over to Aberdeen for treatment or scans. It's devastated my social life. It's affected friendships. Hobbies have gone out the window. I'm losing my job. My career has gone down the pan. And I'm not the only person that experiences this. This is what happens to a great many people who have a CSF leak and don't manage to get it resolved fairly early on. It's a traumatic experience, but it's one that you have to try to cope with. Of course, there are some people who haven't been able to cope. I know of 5-6 people now who've committed suicide as a result of it. I wouldn't say that's really common, but it happens. There was a television presenter, Michelle Watt, a Scottish TV presenter, who ended her life back in 2015 because of a CSF leak that she had got from childbirth, from, I think it was an epidural anaesthetic. So there is the kind of impact on your life in terms of will it kill you, but there's also the impact on your life, and can you cope for the rest of your life. I mean, I don't relish the thought of another 40-50 years having to struggle with this, but I always remain hopeful that things can improve. It's a really tough condition, and what makes it harder is the fact that it's not widely recognised. That the main NHS website, NHS Choices, doesn't even list it as a condition in their A to Z. So to get the recognition and support you need, when even within the medical community there's a real lack of awareness and understanding, it's a tough one to deal with.
Well, we are getting people in touch. Christopher in Glasgow says, glad you're discussing CSF leaks. I myself was recently diagnosed. It definitely needs coverage. Pete in Derby is listening on the internet. A leaker in the UK describes himself. Very fortunate to have a compassionate neurologist who's trying his best to help. Not perform my job as cabin crew for over 4 years because of it. Needs far more awareness. David, we just need to catch up with the travel, and then we'll come back and talk about treatment, whether there is any effective treatment. Teresa's on the travel.
Thanks, Kaye. Good morning. High wind warnings remain on the Skye, Dornoch and Keswick bridges. Edinburgh Travel tweeting to say temporary lights on Lasswade Road near High Street causing delays in both directions. And Gorgie Road, that's the A71, there's a lane closure citybound at Ardmillan Terrace. This is for Scottish Power Works, so delays are likely. Disruption on trains between Glasgow Central and Newcastle via Carlisle today. This is because of industrial action. And the line between Johnston and Glasgow is now now reopen after a vehicle hit a bridge, but there may still be some delays here for the next half hour or so. On the ferries, cancellations to some Mallock-Armadale sailings and an amended timetable on the Mallock-Lochboysdale crossing. And the Oban-Lismore ferry is currently suspended for technical reasons. That's BBC Radio Scotland Travel.
Thanks very much, Teresa. 10:32, you're listening to Kaye Adams on BBC Radio Scotland. Brian Gilmore, our property expert, is going to be with us very shortly. So do get in any questions you have regarding property to Brian. 80295 is the text number, or give us a call on 08085 92 95 00. Right now I'm speaking to David Baldwin, who's one of a very small number of people in Scotland who suffers from CSF leak. This is a cerebrospinal fluid which leaks from the spinal cord or from around the brain. It's a difficult condition to diagnose and indeed to treat, and can cause incredibly debilitating symptoms, as David has described. I mean, basically, if he is lying horizontally, he can control the symptoms. If he stands up, then he has an utterly crippling headache, dizziness, lack of concentration, just wholly debilitating symptoms that have completely changed his life over the last 2 years. I mean, David, interestingly, I don't want to put myself in the story, but I do have an idea of what you're talking about, because only when reading your brief last night, I realised I had a lumbar puncture for a procedure a couple of years ago, and I got on a plane perhaps too soon afterwards, and I had those symptoms that you talk about, and it was like nothing else on earth. And only when I just lay on the floor would I get any relief. Yep,
that's it in a nutshell.
The thought of having that for, well, I think I had it for a week. The thought of having that for 2 years, I can't think.
Yeah, I mean, I'm on almost 5 years now, but I know people who've had to live with this for 16, 20 years. And, I mean, my mind boggles at how they cope for that long. But, I mean, even having this for a couple of days can be quite a traumatic experience. And certainly, as you mentioned, with lumbar puncture, because they are making a hole in this membrane, there will be a leak after it. Now, with many people, that's going to heal fairly quickly, because most people's bodies can heal these things fairly quickly. But it's not an insignificant number of people. It will either take time or it will need help to heal. And while that healing process is happening or not happening, the debilitation that people can feel is severe. And as it goes on, you get added symptoms as well. So that the head pain is something that most people would experience fairly early on, but it can develop into all sorts of other things as well.
Oh, I've got Claire getting in touch with Southampton. I've had CSF leak for 2 years. The impact on every part of my life is huge. Thanks very much to David for setting up the charity. Awareness is so badly lacking. We've got loads of people. We've got Deborah from Cambridge. I'm a recurrent spontaneous CSF leaker since 2007. I sympathise wholeheartedly with what David is saying. 5 in every 100,000 people are thought to suffer from this. Debbie in the Scottish Borders, again, for 6.5 years. Horrendous. Treatments I've had have failed after 6 weeks of less. My partner and my life have changed profoundly, and it's difficult getting through each day. So treatments, I mean, are there any treatments? David, I know, James, you'll want to come in on this, but David, what have you tried?
So, I mean, I've tried quite a few things. What normally doctors will ask you to do is conservative treatment, so basically to lie in bed for a few weeks and hope that helps. But if that doesn't fail, there's a procedure called an epidural blood patch, which you can try, where they inject some of your own blood into the space around the membrane in the hope that would help it to heal. That can have a lot of success, particularly the earlier that it's done, but it doesn't work for everybody, and I'm one of those people. There's a whole, I'm not going to go into why it doesn't work, but there's a range of reasons. For me, the original leaks that I had to be fixed by surgery, but again, it's a very specialist thing. You need to be able to find the leak, and finding it, the diagnostics is probably one of the biggest hurdles that we have. It's just not good enough to always find out where these tiny little leaks are. So there are some treatment options, but there are people who never recover from them, or the road to recovery is really very long and tortuous.
So how long was it before you got a diagnosis?
It took me about 3 months to get a diagnosis, and the studies have shown the average is about 13 months for diagnosis. That's before any treatment, before anything like that. So I was relatively quick, but 3 months is a long time to be going backwards and forwards to your GP, lying in crippling pain on the floor of the reception room and being told there's nothing wrong and it will probably improve on its own. So getting awareness to GP level is a key goal of the charity. But once I then got the diagnosis, because it was in Inverness and the neurology department is quite small there, I had to be referred elsewhere down to Glasgow, and the referrals process takes a long time, so there are more delays, and before I knew it, really 2 years had passed and I hadn't improved really at all, which is why I sought help in America.
Right. Sorry, Stuart has just texted in. I don't know whether this is a familiar idea to you, but could you pass this idea on to David? The symptoms improve when lying down. Would a pressure-inducing suit create the same effect?
It's funny. It's funny you mention. I mean, it might sound funny, but there are these things called abdominal binders that people can wear around their waist, which can help to keep pressure up. But they don't work for everybody, and it also will depend where your leak is. If your leak is lower down in the spine, and you can put the binder around that, then it's applying pressure at the site. If your leak is higher up in the spine, like mine is, my experience of an abdominal binder is it actually makes everything worse. So, if you had a full body suit to do it, I don't know. I'm not sure that's been tried and tested, but if somebody wants to invent something like that and try it out, I'd be a willing guinea pig.
Yeah. I mean, James Walkden is a neurosurgeon. I mean, why is this so difficult to treat?
I think David has partly touched on it. It's difficult to treat because there's normally quite long delays in recognising it. There's good evidence that the speed at which the person has the first intervention prevents long-term deterioration. Unfortunately, as David said, it's not uncommon for me to meet patients who have seen 5, 6, 7 different doctors, no diagnosis made, and certainly no intervention given. And the second problem, which David also touched on, is it's not always easy to find the source of the leak. We could be talking about just a 1 or 2 millimeter defect in the dura somewhere in the spine.
Right. Debbie's on the line. Good morning, Debbie.
Hello.
Hi. And this is something that you have also experienced, Debbie.
Yeah, it happened to me really suddenly 6.5 years ago, where I just felt like I'd been thumped on the head with an iron bar and just collapsed. And ever since then, life's been completely different for me.
And this came absolutely out of the blue?
Yeah. I was getting ready to go out somewhere one morning with my partner and just literally collapsed. And all I wanted to do was lie on the ground. That was it. I just had this overwhelming urge just to lie on the floor. And I was kind of messed around with GP, not my own GP, but a stand-in GP, and they said, oh, it's a migraine, try medication for that. That was on a Friday, and on the Sunday, when every time I tried to get up to go to the toilet or to have a drink of water, I was just collapsing again. I phoned NHS 24 and they sent paramedics out, but they couldn't find anything wrong with me. So, just said, we don't know what it is, it must be a migraine, and left again. And when I phoned my own GP on the Monday morning, he sent an ambulance to take me to hospital to have some tests done because they thought it might be a bleed on the brain or meningitis. Turned out it was neither of those, and I was sent home again with some painkillers because they didn't know what was wrong with me. So I had to wait for an appointment for a neurologist. That was the April, and I got an appointment in the August.
And so all of that time you had this crippling headache unless you were lying down?
Yeah, absolutely. And I tried myself to go to the optician, the dentist, to find out, if there's something else causing this. And it was actually my dentist who told me what was wrong with me because she'd had an epidural that went wrong a few months beforehand. And the words I used to describe the pain and the symptoms just rang a bell with her. Mm-hmm. And she said, ask them if it could be this. So I'm really thankful to my dentist.
Yeah, but you haven't managed to find an effective treatment?
Not as yet. I've had lots of MRIs and imaging done. I've had blood patches, full volume, where they inject quite a lot of blood because they don't know the location. And each time I've had that, it's either not worked or the most it's lasted is 6 weeks. And then, bang, all the symptoms are back again. So it becomes a bit demoralising and disheartening.
And you've been living with this for 6.5 years?
Yeah, yep. And it's horrendous. We tried, I kept being told that I would get fixed, things, I would get better. And so we changed our lifestyle and moved to the countryside and, tried to set up some sort of business that we could work around my health. And again, we're having to kind of change all of that because I'm just not getting better and I can't contribute. And that's a really difficult thing to deal with. So, yeah.
So, I mean, James, is the medical profession stumped on this?
Not stumped exactly, but I have to say the teaching about this condition at medical schools and even postgraduate is zero. It's really only a small subspecialist area of neurosurgery or neurology that even recognises this condition. And that's why, unfortunately, just like your caller described and David described, there's often multiple visits to medical professionals, multiple misdiagnosis before they reach somebody who does understand this condition. But by then, months have turned into years and your success rate of the investigations and the treatment diminishes as time goes on. So it's not that we're stumped, it's unfortunately just recognition of this condition at an early stage and getting the person to the right department with the right expertise. And that's what David's website and charity is all about.
I think one of the things that we've been really trying to focus on is, as James says there, that because people like GPs or doctors in A&E are not going to have ever been taught about this issue or this condition, if we can get guidance and information to them, then they may be able to pick it up more quickly. One thing that the first neurologist who correctly diagnosed me said was that I had absolutely textbook CSF leak symptoms, and if I had arrived in his office on day one, he would have known straight away that was wrong with me. And it was only because the 5 or 6 doctors that I'd seen before him really didn't have a clue about the condition, didn't see the classic signs and symptoms. That, for me, I had a 3-month delay, and other people will get much more. So if we are able to raise awareness of the condition first and foremost, but also get good literature and publications and educational material to doctors who are working at the coalface and are going to see people presenting in the early stages of this, that could make a real difference to people.
Well, we're certainly being contacted by lots of people who are experiencing this, and I guess lots of them probably connected with you and your charity, David. So in terms of awareness, if we're a tiny, tiny wee part of that, we're more than happy to be. And I wish you all the very best, both in raising that awareness and your own personal health. And Debbie, to you as well. Thanks very much to James Walkden. Julie says, brilliant discussion on CSF leaks. Mine's been going 5 years, undiagnosed for 3 from an epidural going wrong at childbirth. David's expertise helped me get diagnosed via Facebook support group. And John in County Durham says, CSF leak ruined my life for 4 years, career, savings and marriage all gone.